We use the term sexually transmitted infections because I think diseases are more looked as terms that are not curable, that stays with you for a very long time. The word disease almost has a stigma. So we don't use that word anymore. I think we are using the word STIs, which are sexually transmitted infections. So I think it clearly explains what it means. These infections are sexually transmitted. Yeah, and because they are infections, they are bacteria or viruses and fungus that can be transmitted through sex. And there are testing, like how you test for any bacteria and virus. There is treatment as how you test and treat any bacteria or virus. Like, for example, if you have a viral cough or a cold, or if you have a bacterial cough or a cold, the same way, if you have a viral STI, you treat it. If you have a bacterial STI, you treat it. There's nothing different. I think as far as we accept that sex is a physiological process and everybody's having it, I think the word infection is the key. If it's okay to have a bacterial, I don't know, sore throat, it's okay to have the bacterial STI. I think the word sexually active is the one that we have to actually focus on, because a lot of the people think that only if you're having penetrative sex, like if a penis goes into a vagina, it is sex. So everything else, people try to think that it is not sex. If genitalia are, if they're rubbing, or if they are rimming, or if they are, oral sex, blowjobs, any of those things, people are not considering that as sex. But to be honest, all these things are something where you having, your bodily fluids and your personal parts and your skin to skin come in touch. And if that is happening, the chances that somebody can spread STIs, even without having penetrative sex, is likely. So anybody who's, getting involved in anything that is sexual have a chance and risk of acquiring an STI depending on what the sexual activity is. Women and men, I think you can have similar STIs that are common in both. I'm just going to classify STIs in a way that it's easy for people. So one is STIs that is transmitted to body fluids, right? Like your vaginal discharge or your sperm, semen, pre-cum and stuff like that. The other is an STI which can, spread through blood, and again, body fluids and, and stuff like that. And then there is another STI which can spread from skin to skin contacts. And there are viruses that can spread from skin to skin contact or spread through ulcers and cuts and stuff like that. So mostly when there is, the pubic area or the genital area skin that is rubbing, and you have genital fluids all mixing up and touching each other. And that's how your spread of STIs are going to happen. So common STIs are, gonorrhea, chlamydia, trichomonas. These are STIs that are very common in people's vagina and urethra. And you can just test for these STIs with a urine test or a vaginal swab. Or if you're someone who's engaging in anal sex, you can do an anal swab as well. The second type of STIs, like I said, are like bloodborne viruses. Like, for example, you can have hepatitis B, you can have HIV, you can have like syphilis. And if you're having, some symptoms of syphilis or HIV, like ulcers and stuff like that, you can also find out from the ulcers. But if you're not having any symptoms, usually these things are diagnosed by blood test. So having a blood test to see if you've got these infections is very important. And then there are some infections which happen from skin to skin contact, like, for example, HPV, which is your wart virus, and your HSV, which is your herpes virus. These two things occur just from skin to skin contact through oral sex and stuff like that. And for that, it is hard to test if you don't have symptoms. Like, for example, there are antibody tests that you can do. The antibody test just pretty much tells you that at some point in your life that you've been exposed to it and you've developed antibodies. It does not really diagnose you of whether you have herpes or warts and stuff like that. Do you know what I mean? So it's hard for those tests. But warts have a fantastic test in women called the pap smear, because warts or the HPV is the one that causes cervical cancer. And I think we've come very far in terms of cervical cancer. The very important thing for women is to get your pap smears very regularly with your doctor. And get your vaccination. So the cervical cancer or the HPV vaccination is something which is again made a big breakthrough. And both men and women who are young and haven't started their sexual encounter yet should actually go and get it before they start having sex, so that, it's such a common virus and you don't know whether you're catching it from people or not, because not everyone is symptomatic, just like COVID. And so that is something there for you to again protect yourself and prevent yourself from HPV. Boys should also get HPV vaccine. One is because men sometimes are gay and they're having penetrative anal sex, and the cause for anal cancer is HPV. So that is one thing. The second thing is you also have genital warts, which even men can get. And sometimes people get throat cancers and pharyngeal cancers with HPV. So men actually benefit really as much as women do, though they don't have a cervix, by getting the HPV vaccine. So in a lot of developed countries, both boys and girls get the vaccine in high school. That lot of the time, STIs are asymptomatic. So they do not have any symptoms. And I think that is the take-home message today is STIs are asymptomatic. You won't know whether you have it or not until you get tested. So please don't think that I don't have any symptoms, I'm feeling fine, I don't have to get tested, because the only way you can be sure that you don't have an STI is by testing. Common symptoms with STIs are, like, for example, in men, it can be urethral discharge, it can be burning when passing urine, and it can be pain in the bottom if you're having anal sex. It can be pain when you're going to the toilet. There can be blood and discharge from the bottom. So all these can be symptoms of STIs in men. In women, abnormal vaginal discharge is a symptom of STI. And I think it gets a little bit complicated there, because in women, discharge is normal. So I think that is why, I keep telling women, know your body. Knowing your body is very important, because you need to know if your discharge changes, if it smells differently, if it looks differently, the color is different. Because unlike in men, for women, discharge is normal, and discharge changing around your cycle, it being a bit thick, a bit less, is common as well. So when it really gets abnormal, it's hard, and women actually miss out a lot of the time to figure it out that it's gotten abnormal and I have to check. So it's important to know your body and your discharge, and abnormal discharge is very important part of STI in women. And they can also have burning sensation while passing urine. They can have itching in the vagina. They can have redness, swelling. And a lot of the time, people can have ulcers, cuts, bruises in their genital area as symptoms. And sometimes when you're having like STIs, which are bloodborne, like, for example, HIV and syphilis and things like that, you can also have generalized symptoms. You can have a full body rash. You can have lymph nodes all over the body. You can have fever. You can have ulcers in your mouth, and you can have like thrush or fungal infections in your tongue. So you can have all kind of generalized symptoms as well. Usually, I think that when somebody with HIV are having full-blown symptoms, it's not a good sign. You don't want to leave it that far. So I always tell people, if you feel you're sexually active, you know yourself best. So if you feel you're sexually active, if you feel like you have not used protection where you should have, or you could have, or you didn't, whatever it is, rather than saying, oh, he's a good, nice guy. Oh, I know him. He's a good friend of mine. Oh, or I don't have symptoms, and saying any of these things, because these things are not valid when it comes to an STI. Absolutely gorgeous person can still have an STI. So I won't pretty much, go by it. So definitely go and get yourself tested. So if you feel like you've had unprotected sex, you know it the best. So go and see a doctor, get yourself tested. And that's the only way you can be sure that you don't have an STI. STIs, a lot of the times, are curable. So it is very important to go and see a clinician and get tested. Don't be scared to be diagnosed with an STI. And I think that is what is very important, because a lot of the times people think, I don't want to know whether I have it or not, especially like HIV and things like that, because the treatment is fantastic these days. Most of the things are well controlled, it's curable, and it's very, very important. The second important thing is about treatment, I have to say, is, HIV is no longer a death statement. treatment. People don't have to be worried. Everybody who got HIV was dying, and that's not the case anymore. So anybody who has HIV, if you get diagnosed early, if you start treatment early, you can have actually a normal life. It's become more like a chronic illness, like diabetes or hypertension, where you just take one tablet once a day and your virus can be undetectable. And if your virus is undetectable, people are getting married, they are having unprotected sex with their wives, they are having children, they are having a normal life, even if they are HIV positive, but if they are on treatment. So treatment has come a long way. And in order to prevent yourself from getting HIV, condoms, yes, definitely are the best way to go. However, there's also medications that prevent yourself from getting HIV if you're someone who's having unprotected and high-risk sex. So talk to your doctor about all these things, because HIV and treatment of STIs have come a very, very long way. It's, yes, there is a bit of a stigma, and I think all of us here are trying to work on the fact to normalize sex, to normalize infections that are transmitted to sex, because everybody's sexually active. And we're trying to, advocate on use of condoms, which is probably one of the most effective way of preventing STIs. And yes, and educating people in doing the right thing, because saying don't have sex is not working. Clearly, our population is increasing. So I think have sex, but do it in the safe way, and come and get yourself tested and treated and do the right thing is probably something that's more sensible and feasible to do. Different STIs have different length of treatment spans. Some have a week, some have 2 weeks, some have 3 months, and things like that. However, if we are talking about like chronic STIs, like, hepatitis B or HIV, they could be chronically having it for the rest of their lives. However, it can be well controlled and managed. And that is why they need to see, a sexual health specialist or an infectious disease specialist to actually keep doing that for the rest of their life. When I say rest of their life, people usually think, oh my God, I have it and I'm going to give it to everyone else for the rest of their life. And that may not necessarily be the case. You may still have it and have the virus controlled, so you don't spread it or transmit it, for the rest of your life, but you can just carry it and keep it under control. So a lot of those things are available in today's, STI land. So it's hard to say that it's not like one infection thing, because there's a vast amount of STIs that are there. But what I would like to really tell people is, if you're getting tested early, your treatment is possible. Most of the STIs are curable, and those that aren't are actually well controlled as well. So you don't have to really worry about it. I think it's definitely not gotten to a point, how HIV was life-threatening at a particular point in time. It's not like that anymore. So you definitely have to reach out and ask for help and then get the right information. Undiagnosed STIs in a female patient, let's just say, can lead to transmission of STIs to the child. Like, for example, if you have chlamydia and the baby is coming out, we've seen that kind of blindness, even a lot. Yeah, cause of blindness is chlamydia trachomatis, which is passed through vaginal, infections and stuff. Yes, that can happen to children. You can pass herpes if you have it undiagnosed to children and cause really bad encephalitis. Syphilis can be passed that way. HIV can be passed that way. Some of it can be life-threatening. If women have undiagnosed STI for a very, very long time, the biggest consequence of undiagnosed STI is pelvic inflammatory disease, where all your pelvic organs, including your ovaries, your fallopian tubes, and everything get really inflamed. And when the inflammation comes down, they heal with scarring, and your fallopian tubes is completely blocked. And pelvic inflammatory disease is the biggest cause of infertility in India. So clearly, sex is happening, and undiagnosed STIs cause pelvic inflammatory disease, which is the biggest cause of STIs in India. So please go and get tested as frequently as you want, as frequently as you can. And you know yourself, you know your risks. I can't emphasize enough. You don't have to discuss. It's not a public matter. You don't have to discuss this with anyone. And this is not moral grounds. There's something very important I want to say is immediately when we're talking about sex, when we're talking about STIs, people usually compare that with somebody's moral grounds. Or like I said, oh, he's such a nice person. Yes, but I want people to understand nice person can have a good sex drive. and a nice person can be sexually active. And yes, when you're sexually active, you tend to catch some infections at time if you haven't been safe, depending on, what it is. So just get yourself regularly tested, use the condoms, and these things are sensible things to do when you're sexually active.